Hi, Paul Sakis, Good News Broadcast, speaking to Dr. Kathy Magliato. Hi, how are you?
Hey, Paul, how are
Did I
you?
say your name okay?
Pretty good. Magliato. It's a Italian tongue twister.
There you go. Well, we
Yeah.
like that. We like Italian food, too.
Wonderful. As long as
uh,
it's heart healthy, Paul, I don't care.
and I hear you. And so, Doctor, actually, a memoir of a female heart surgeon healing hearts. Um, it's a powerful, moving memoir that demonstrates your passion, commitment to your family, your patients, your profession, and you're currently the director of Women's Cardiac Services at St. John's Health Center in Santa Monica, California. And tell us about Healing Hearts.
Well, Paul, it really was a book that initially started out as a book to educate women about heart disease because, as you're probably aware, since it's Women's Heart Health Month, February, that heart disease is our number one killer. And the book really came about, Paul, because I was so frustrated at watching women die from heart disease, which is a disease that was largely preventable. So initially I wanted to write a book to educate women, but the problem with that, Paul, is that women just don't wake up in the morning and say, gee, I want to go out to a bookstore and buy a book about heart disease in women. So I wanted to make it a little more interesting for women to read, and so what I did was I used the actual stories, very poignant, very tragic stories of women who I have taken care of throughout my career who have died from heart disease in an effort to educate women. And then I met this wonderful publishing agent who said to me, well, gee, Kath, I really want to hear the story about heart disease in women, and I want to hear your patients' stories, but what I really want to hear is I want to hear your story, the story of being a heart surgeon, of coming from a farm in upstate New York and then becoming this heart surgeon in California, balancing a liver transplant husband and two children. He said, I think that's an important, very inspirational message. So that's really, Paul, how the book kind of morphed into a memoir. But at its core, it's a book where women will learn about heart disease.
Well, let's talk about some of the women in the book. Give us some examples.
Well, there's a couple of chapters that really deal with prevention because again, 80% of all heart disease is preventable, and some of the chapters also deal with the symptoms of heart disease. And one story in particular was actually a friend of mine. Her name is Donna. She's 64 years old right now, but when she had a heart attack, she was in her 30s. She was 34, so that was like 30 years ago. And at that time, women didn't know anything about heart disease, nor did their physicians. And she's a Hollywood producer, so she had this very high-profile, very stressful job. And she went out jogging one day and then came back for lunch, and the next thing you know, she's dizzy and lightheaded and sweating and having chest pain. And initially went home. I called her doctor, who promptly told her that she was having a diaphragmatic stitch, whatever that is, from running, which is she often did. And it wasn't until she found herself lying on the bathroom floor, resting her head against the tiles because it was cool, that she said to herself, my God, there's something wrong here. And she recognized that she was having something more than a diaphragmatic stitch and wound up actually saving her own life because she got herself to a hospital and they treated her. And that's a pretty valuable lesson to women, to listen to their bodies and understand, what their symptoms are and when to call 911, when to go and see a physician.
Let's talk about another woman in the book.
Well, I can tell you stories about women that I encountered during my training as a heart surgeon. One story that's particularly difficult for me to tell is a story of a baby that I took care of when I was in my training as a cardiothoracic surgeon. It was one of the first babies that I'd ever encountered with heart disease. And the sort of sad thing about congenital heart disease or heart disease in infants is that they're born with the disease. They don't accumulate the disease from smoking and leading a bad lifestyle. So they're just so innocent. And this baby, after we operated on the baby, I then stayed in the hospital for 11 straight days at that baby's bedside, taking care of her. And she didn't survive. And when she died, her parents couldn't be with her when she died. And so what I did is I stayed at her bedside, and the nurses did something very, very beautiful. They actually took her out of the incubator, and they handed her to me, and I held her while she died. And that for me I think, changed everything I was as a surgeon. It made me be a caring and compassionate surgeon. It made me connect with my patients. And I think the most difficult part of the story was I then had to take this now deceased, now dead baby and walk it down the hall to its parents, where they could then sort of hold her and have closure. And that was a particularly difficult story of watching a woman, a girl, a child at a young age die from heart disease, and it was very frustrating for me that I couldn't save her. But in the end, I think I paid her the respect and the caring that she deserved, even when she left this planet.
Thank you for doing that.
Thank
you. What brought you to go into this field?
Well, that's another great story, that the book actually opens with, and it's called Love at First Touch, which I sort of have to clarify for the listeners, because I know that must sound kind of odd, love at first touch. But it really was, Larry, the first time I ever held the human heart. And it was a time where I was an intern in general surgery, and I was this young, sort of budding general surgery resident whose job it was to basically stay out of the way and not hurt anyone. Just like you see the students in training, the interns in training on Grey's Anatomy, I was one of those. Mm-hmm. And there I was at the front of the OR board watching the cases for the day to see what the schedule was like, when a nurse sort of runs out of an operating room and yells, "Dr. Netter needs you in OR 7, and grabs me, of all people, and throws me into an operating room. And what I saw in there was just chaos. I mean, just people running in every direction, a lot of yelling, instruments flying, and in the midst of all this was this patient on an OR table with blood just, coming out of their chest. They were bleeding to death, and the surgeon trying to save their life. And then the surgeon turns to me and says, "Glove up and get up here and help me." And I thought, oh my gosh, he can't possibly be talking to me. I'm just a lowly intern, right? Mm-hmm. But in fact, he was. And one of the things you need to know about me is that I have these very large hands. I have hands that can span 13 keys on a piano and hold a palm of basketball. And so that's actually exactly what this surgeon needed, was this large-handed intern to come up there and palm the heart for him and hold it steady so he could whip-stitch the hole shut in the heart. And so that's exactly what I did. And I got to tell you, the moment I touched the heart, I thought to myself, my God, this is incredible. And so I asked this surgeon, "Do you do this every day?" And he said, "What are you talking about, do I do this every day?" And I said, "Well, do you touch the human heart every day?" And he looks at me like I'm, an idiot, and says, "Well, of course I do. I'm a heart surgeon." And that was it for me, Larry. That was when I decided that this is what I wanted to do every day, was to touch the human heart. And that's how I became a heart surgeon.
Congratulations. 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 You have a new website with your own name, right?
KathyMagliato.com. Yep. Just
Perfect.
Recently put it up.
Magnificent. Great. Last quick question. What's good news for you? I think it's just sharing all this good stuff that you got.
Oh my God, this is all wonderful news. I mean, I'm so proud to be an author, because again, I'm a full-time heart surgeon. This is my first foray into writing, and the way you hear me speaking, on the radio and the internet now is exactly how I wrote the book in my own voice. So I hope you all enjoy my voice, because it really comes from my heart. So thank you.
We can feel it. Kathy, thank you so much for sharing good news.
Thanks.